This is your original joint where you've worn down the articular cartilage and you've worn down the socket.
The fundamentals of a hip replacement haven't changed much.
Hip replacement is removing the damaged articular cartilage and bone.
But in recent years, more doctors are taking a different approach.
You can come through the posterior buttock region, or you can come from the direct front of the hip joint. You can come from the side of the hip joint. The hip replacement is the one procedure in orthopedics that the approach can vary based on your surgeon you choose.
The most common way to access the joint is through the backside, which comes with some resistance.
The posterior approach does go through the biggest muscle in the body, which is the gluteus maximus muscle. So you split that muscle, you have to actually remove some of the short external rotator muscles of the hip joint and the hip capsule to get to the hip.
Jennifer Inskeep labored over the idea of a hip replacement for years.
I'm an active person, so I was very tired of hurting every time I did something.
The newer anterior or frontal approach helped change her mind.
This procedure is easier, shorter healing time because they don't cut the buttock muscle, so that's one less thing that has to heal.
Literally, you do not remove any muscles or tendons off of the bone, so you're basically separating and pushing muscles apart as opposed to cutting and splitting them. That procedure done correctly is dramatically improved as far as pain control and recovery times.
A primary concern with hip replacement surgery are dislocations, which are more common if the muscles have been cut. Using the anterior or frontal approach cuts down on that complication.
Right, you maintain the soft tissue, you maintain the hip capsule and the short external rotator muscles, which are very protective.
The change in attitude sat well with Jennifer.
I was on a horse 5 weeks after surgery.
For Lee Memorial Health System, I'm Amy Osher.